This week we're going to be featuring a team of experts who will show us the state of the art in all things makeover in a segment we're calling Renewing You. We'll feature the latest in hair and makeup, fashion, and plastic surgery. And we'll have details a little later on how you can possibly have the opportunity to win such a makeover. With us today to start our week of Renewing You is Dr. Stephen Goldman, who is a plastic surgeon from Beachwood Plastic Surgery and Medical Spa. Doctor, thank you very much for coming. Nice to have you here.
Thanks for having me,
One
Fred.
of the things we keep hearing so much about is that more and more plastic surgery is not surgery. You're not really going under the knife. Can you explain what's happening?
So I think it's really just an expansion of the spectrum of options that are available. So surgery certainly, for instance, with a facelift remains the gold standard in rejuvenating a face and making a face look younger. But many patients who come into my office, for instance, don't require a facelift. And so it's nice to have a gamut of other options, including Botox, which is obviously very well publicized, and the second class of injections that we do for making a face look younger are fillers. So basically compounds that we inject into creases in the face to add volume, to plump them up, to camouflage them.
Is it preferable in the overall scheme of things to do it that way, to use the non-surgical approach?
I think it's preferable to use the right approach for the right patient. So some patients really don't need surgery. Some patients really will benefit from these non-surgical therapies, and some patients, in fact, benefit from a combination of multiple modalities.
When you do these non-surgical approaches, is there a recovery time?
So the recovery time for most of them is very minimal. So if somebody, for instance, gets Botox, most patients, less than 5%, won't even have a bruise. So those patients can literally go out to dinner afterwards. For the injectable fillers, the same is true. Many patients are getting these things over lunch. On the other hand, the more involved whatever we're doing becomes, the more chances that there's a little bit of bruising or something. These are still procedures that are done in the office, but patients may have to have a little bit of swelling or bruising that they camouflage with makeup, for instance.
Well, Dr. Goldman, you brought some pictures with you of some of the non-surgical options for patients. Let's take a look at some of them. Tell us what we're seeing here.
So these are just some examples of how these non-surgical modalities can treat a patient. So this is actually an after photograph of a patient who had a filler injected into the trough between her eyelids and cheeks. Do you guys have a before picture there too?
Can we go back to the before?
It'd be nice to compare them both, but there's no before picture. At any rate, you'll see that there's a smooth transition from her lower eyelid to her cheek. All right, this patient is somebody who had a non-surgical rhinoplasty. All right, basically that's a technique where we put fillers into the nose in specific areas to camouflage a hump or bump on the bridge to make the tip look like it's more rotated. So that patient had her tip rotated up. Before it used to look like it pointed down. This is a more classic use for an injectable filler. This patient had fairly deep furrows or grooves or troughs between her cheek and her upper lip. Those are called the nasolabial grooves. That's the parentheses that's being advertised. There she is before. All right, so that helps show you before versus after and how the presence of a filler can make that groove look more shallow.
And it really is quite dramatic.
It makes her look younger. This is technically surgery. This is a laser resurfacing. And do you have two pictures of that patient? See if you have another. There she is after. You just see the skin looks smoother, shinier. The neck actually gets lifted just a little bit from the skin tightening effect. So that's a facial laser resurfacing, and it tightens and smooths the skin, not necessarily using a facelift. It doesn't replace the facelift, but it really makes a nice difference in terms of the texture of the skin, and it can be dramatic, but that procedure, for instance, has some recovery associated with it that's fairly significant. So we have to educate our patients about the various options. Some people really would be well served with surgery, but don't have the time to do the recovery.
Can you tell us a little bit about the Renewing You contest that's coming up?
So the contest that's coming up is actually a very nice contest because it uses a multidisciplinary approach to treating a patient. So these are basically other non-surgical modalities, but they're not plastic surgery. So there's a dentist working on the patient's teeth. Jeffrey Paul is doing hair renewal or hair restoration on a patient who had some hair loss, a woman who had some hair loss. And these things can be used in combination with plastic surgery, including non-surgical therapies, to comprehensively treat the patient.
On Saturday, October 4th, there will be a forum where you can meet the experts on these procedures. You can call 440-333-8939 to register, or you can get in touch with Dr. Goldman's organization, Beachwood Plastic Surgery and Medical Spa by calling 216-514-8899 or go to www.drgoldman.com. And the contest, of course, an opportunity for you to win a makeover, and you can learn about that by going to wkyc.com and click on contests for more details and enter Renewing You. Many thanks. It's nice to have you here, Doctor.
Nice to be here.
Great pleasure to see you. Coming up, your chance to win tickets to see The Duchess.
This segment of Good Company was paid for by Beachwood Plastic Surgery and Medical Spa.